Hi, I'm Baljit, founder and CEO of mTatva. I founded mTatva last year in January is when I left my job and started it, and we formally got incorporated in April 2016. Prior to this, I have worked for almost 11 years in multiple big companies as well as startups in the IT area in technology management as well as business roles. 4 years back is when the bug bitten me. I was visiting my parents in Haryana, and I saw that there is a big gap, in terms of what they need in terms of healthcare facilities, and technology can be used. And I started to work on telemedicine solutions, looking at doing market research, doing some prototypes, and finally what I found out was telemedicine is too complex a problem to solve in terms of it has multiple things which need to be resolved. First, for example, doctor accepting the technology, patient accepting the technology, right? There are logistical aspects, patient available, doctor not available, and all that. So we thought, rather than jumping on to telemedicine, why not introduce technology in the outpatient department, that is primary healthcare first, and let naturally migrate to telemedicine. And that's where I started. And finally, last year is when I took a step and started mTatva, which is in primary healthcare IT. mTatva is a primary healthcare IT company. So when I say primary healthcare, it is outpatient department. If we see, 60% of the total money spent in private spending in healthcare in India is in primary care. But a lot of innovation is happening in the inpatient department when patients get admitted. There is hardly anything happening there, and the pain points which we see is patient doesn't get benefited. I mean, there is technology used by all sectors everywhere, but if I go and see my doctor, there is nothing. I take prescription, go back home, prescription lies somewhere else, I forget to take my medication, no one knows whether I completed my treatment or not, whether I recovered or not. So that's where we wanted to have a solution, complete solution, where patient the relationship doesn't end as soon as patient walks out of doctor's room. It's a continuous relationship till he recovers. If there are any connections which need to be made between patient and doctor, that can be done. And we provide a nurse on mobile when patient goes back home, which can take care of some of his worries. For example, taking medications on time, understanding his or her health queries, and maintaining the records online. There are multiple companies which we see as of today. For example, there are companies who do EMR and provide similar solution. The challenge we say there is they expect doctors to make entry. Doctors are not data entry, doctors are not tech savvy. So that is the way we are different. We do not sell EMR solutions, right? The other thing which we saw in terms of information, right, which is given to a patient, there is people have to go on Google, find on their own, so they are worried about relevance of data, quality of data, and then they have to go to multiple websites to actually get down to what exactly they need. Right, so there we know what patient is going through. Right, we know what he has been diagnosed or provisionally diagnosed for or treated for. We have an information bank of 200 plus, and it is growing ailments, common ailments, for which our clinical team has created data and reviewed by doctors. We actually give that content to the patient. Something like this is not existing as of today, which we believe. There are healthcare providers who work in bits and pieces, but not as a complete solution. The other way why we are different is we just do not have a platform which we actually put up and keep it off, and we actually provide our a complete solution. So which means no workflow changes for doctor or patient. As a patient, I just walk down to doctor's office, and when I come back, everything happens automatically. So all the complexities of data entry, making the records available online, or creating the information content is handled by our team at the back end. There is one thing which we need and that is scanning the prescription. Right now, the way it works is patient sees doctor, comes out of his room, goes to pharmacy, takes medication and go back. Somewhere in this flow we need to intercept the patient for 10 seconds, take his prescription and scan it. So there is an education which, we are actually spending some amount of time in educating the patient, this has to be done, why it is important for them. So that is one of areas where we are spending a lot of time. The other, of course, challenge which is always there is to sell it to the providers. We are actually looking for partners who believe in thinking that these solutions should be given to patient, because this helps patient recover in a better way and a faster way. So trying to convince and find some partners in that area. So we are not selling as of now directly to the patient. So since we are serving the patient, but we are going through the hospitals or clinics or doctors. So we are actually selling to businesses, partnering with them, and we are enabling service providers for them. So that's where our revenue come from. It's mostly on paper use as of now, paper prescription. So coming on to future expansion, we believe the biggest value this solution can add is to people in the remote areas. So when I say that, they are the ones who are medically very less literate. They are the ones who actually doesn't understand what this medication is about, whether they just know Ilagoli, Haragoli, and that's how they take it, and they miss their medications, and then complication arise. That's where we want to actually have our services, SMS solutions, as well as the information content in multiple languages, and reach out to them. That is one aspect which we are looking for after reaching out to urban crowd. Now coming on to funding, right now we are self-funded, funds put in by me and some friends. We are very well funded as of now. We would be trying to expand our base from 215 patients new sign up to close to 700-800 new sign-ups, and that's when we look for some angel round in a couple of months from now.